So she actually strives to emphasize the need of palliative care training in budding nurses and doctors of India. So she takes much interest in training, and she has 18 plus years of experience in nursing. And I want to tell you that she's a certified trainer from National Health System Resource Center, which is a national level recognition. And the best part is that she, in the year 2020, she was recognized as the pioneer nurse by St. Christopher Hospice, UK, world's first hospice. I think we all can clap for her. And welcome, Sheeba, to the session. Over to you. Thank you.
Thank you, Sunanda, for the nice introduction. Good evening to all. Happy to see you all. So today we are going to learn about home-based care. I think last 3 days you were learning about palliative care. So before I'm going to home-based part, I would like to hear from you all. What did you learn from the 3 days? What is palliative care? If anybody is asking you what is palliative care, then how will you answer? So just do a recap and then move on to the home-based part today.
Sister Siva, before that, I want you to look at the chat box. Everybody has congratulated you. So just have a look and feel good about it. Thanks.
Thank you. Thank you. Okay.
Yeah, I think I would want to try and talk about what I've understood is palliative care. So this is Ravdeep here.
Yes.
I think it's about the approach to this patient beyond just the physical care, right? It's about how we approach and take care of the psychological, the socioeconomic, and the spiritual health. Because when we say health is just not physical, it's the total sense of well-being, right? Which involves the physical, mental. So it's about bringing the patient to ease, who we know is kind of terminally ill, and maybe hospitalization or things might not really improve for that patient. So how we can minimize the pain, which could be physical, mental, and bring that sense of little well-being, right, to make it easy on the patient. And of course, as I've also understood it, it need not start only at a point when the patient is going to become so critically ill. It could also, depending on the situation and the need, the palliative care can start at diagnosis. And it's equally important that the counseling plays a role for the caregivers as well. So yeah, that's in a nutshell, which I thought, yeah. Thank you.
Thank you, ma'am. Thank you for the
I
explanation.
think it's a holistic approach and
Okay.
a very specialized kind of a care, and where the focus is on to manage the symptoms rather than the disease. And it has multiple dimensions, including your psychosocial economic aspects. Ultimate objective is to make life dignified and easy for the person who is very, very close to end.
Okay.
I think what is also more important over here is that we are talking also about the care decisions that you can share with the patient when they are diagnosed with any kind of an illness, and kind of empower them that, okay, fine, this is something that I can this is something that suits me. And as I think Ravdeep and even Vinita ji said, that it's all about empowering them to lead a dignified life. And of course, there is a lot of options over here that come with, providing for the caregiver any kind of support that is there. That's for me what palliative care is all about.
Okay. Thank you, ma'am. Any other persons would like to add any points? So thank you for your contributions. So as all of you are mentioned about total care, so this palliative care is totally aiming the total care, because right now in our healthcare settings, we all are focus on just focusing on physical care. But in addition to that, if they have a physical distress, if they have a psychosocial, the other part, psychosocial distress there, their physical distress will increase. That all things we should uh, keep it in mind always, all the time. So the total care, the total pain concept is very effective here. We have to do the proper assessment, physical, emotional, social, and spiritual assessment, and also you have to try to manage the four aspects. Then only we can able to improve the quality of life of the patient and their family. Here, one more thing you learned is not only for patients, it's for family too. So if just imagine a person get a life-limiting illness or a life-threatening illness in their family, that whole family will be affecting, right? So along with the patient, the family, the primary caregiver is also affected, because they have to go with the patient all the time, be with the patient all the time. They are the person to take care of the patient. So nobody is there to listen their concerns and emotions. We all focusing on the patient's problems. So we are the person to sit there or just find out a time to listen their problems too. If you ask any caregiver's problems, definitely they will start crying, because nobody is there. Everybody is there to blame them. Maybe the neighbors sometimes come there and blame them, and other relatives will come there and blame them. You could done more. That kind of blaming will be there. So uh, we are the persons now understand what are the problems affecting with the patient and the family. So we have to understand their emotions too. So, and also we need a teamwork. So this is the volunteers are the most important part in palliative care, because without your support we can't do that much, because you are the persons work in the community. You are the primary persons for identifying in the patients who all are suffering in your community. You can able to connect with, you can go there and see the patients and find out the patients, find out the patient problems. And if you are not able to manage, then you can connect with the other family, the palliative care team, so that your teamwork is built up there. So if there is a connection with the then with the palliative care team will come there and see that patient along with you. You are the primary person to connect with us. So yeah, then after that treatment, you can go there and see that patients. Is there the treatment is good, effective, beneficial to the patient or not beneficial? That all things you have to. So volunteers are they're doing a major role in palliative care. So let me share my screen. So now, as I mentioned about before, so today we are going to learn about home-based care. So, so let's see who needs home care. So now we all understand that what is palliative care. The person who are getting life-limiting illness or a life-threatening illness, the patient and family need palliative care. Okay, and total care. So we need proper teamwork is improving for there to improve the quality of life of the patients. How we can improve the quality of life? How? So we have to identify the problems and try to reduce the symptoms. If you are able to reduce their signs and symptoms, definitely we can able to improve the quality of life of the patient. Okay, so let's see one by one who needs home care. So the persons who are not able to come to your palliative care clinic or the hospital. So see this picture. This patient is, this person can walk, but because of his physical problem, he can't. So that time you can provide palliative care to this patient, to provide home care to the patients. Our aim is to reduce the distress first, and then after that he can able to come to the palliative care OP. So those who are physically unfit or unable to travel, that persons you can consider to provide home care to the patient. And the next one is no one to bring them. So, like in old days, nowadays nobody is there to take care of the geriatric patients. So here, this patient is lying alone. Nobody is there to bring them to the hospital. So that time, what if they have some that kind of problems there? What you can do is you are your community. Sometimes you just imagine in your community. This kind of one person lying down. What you can do is you can go there and talk to the neighbors and try to maybe you can inform to the panchayat member like that. Then you can bring the patient to the hospital usually. But if they are not, if nobody is there to bring them to the hospital, you can able to provide home care. So just to think about that. So there are many ways, but you have to think about the easy ways. If you provide home care to the patients, you can able to provide a good relief to the patients. Because of the transfer time also, the patients will be suffering a lot. And the third one is financial strain. Just think about one patient, one bedbound patient is staying in this situation. So we will usually the doctors say at the end of end stage or after the curative treatment, they will say like they will try all the curative part and they will say it like nothing more we can do. They usually have a Foley's catheter, for urination. So that all things they need to change it every month. So they will send them back. Just imagine a patient is lying staying this kind of house. Each month they have to come to the hospital for changing the urinary catheter. That is must. Otherwise, urinary tract infection will be there. No, they should be changed. Who will help them to come to the hospital? Even the local people will be able to help them to go to the hospital, but financial problem. They have to find out the money. Vehicle, they need a vehicle. They have to pay that vehicle amount also. So usually what they will do is they will take money from the neighbors first. If they don't give back, nobody is willing to give again. Then they will ask another person, other friends or relatives. So they will be going to debt because of this treatment. So if you give a home care to these patients, definitely we can able to reduce the financial burdens and reduce their emotional stress also. Here, walking distance to get the transport. Sometimes we need to be carried. No, so if a bedbound patient is there, you have to carry some because at least 5 persons therefore carry the patient to the vehicle. From the vehicle also, when we reach the hospital, we need to again the same job. From the vehicle to trolley to patient bed. So these, how many, you just think about how many shifting therefore at one catheter change. From house to vehicle trolley from trolley to vehicle to the hospital, in front of the hospital trolley, then hospital trolley to the hospital bed. So how many shift were there for one catheter change? If you provide a home care to this patient and give that catheter change at their home, how much relief to the patients they will get, patient and the family. So that is why we think about the home-based care and palliative care. The home care is one of the vital part of the palliative care. So these are the components of home-based care: physical care, emotional care, social care, and spiritual care. So we all know that this is a total the care. This is the whole concept of palliative care. Let's see one by one. So before moving to the actual part, so I would like to hear from you all. Now you all learned about palliative care and learned about communication, and you are going to see the patients after one or two, maybe or one more session is left. So after that, you definitely you will go there and see these kind of patients in your community. Okay, if possible. So if you have seen these kind of patients in your area, what all things you will do for this patient? Just think about that and unmute yourself and talk or put your answers in the chat box. So this is a 40-year-old man diagnosed with paraplegia. So when you see this patient, the patient is having Foley's catheter for incontinence of urine. Incontinence of urine is the urine is drained, the uncontrolled. Whenever the urine that comes to the bladder, the urine will come out. There is no control. So that's why the medical team were putting the Foley's catheter. Okay, and wife and he has wife and two daughters. That wife is a homemaker. Eldest daughter is studying in 11th standard and younger daughter is in 9-year-old. So if you have seen this kind of family, what are the things you have to be checked and what all things you will try to address? Connect to near palliative care team. That's very good. But how will you connect? You have to do the proper assessment. Then only you can able to connect with the patient, that palliative care team. Definitely, if you when you call the palliative care team, they will ask you a few questions.
So as a volunteer, I think it's first important to pay a personal visit. And I think all the things that we've been learning from that, if we can kind of make an assessment as to their affordability in terms of that palliative care, whether they'll be able to visit, like you just mentioned, then the condition of the patient in terms of other symptoms besides just taking care of the catheter. If there's other pain, there's any other psychological requirement for counseling, the whole, I think, assessment needs to be made before we can decide whether at a next frequency the patient can visit the center where all that can be provided, or we really need to give a home-based care. Because like we say, the daughters are young. They cannot each time leave their school and college where they're studying to get the patient there. The father and wife being a homemaker, from that only it looks like the affordability could be a little bit of a concern. So yeah, that's, I think, a little bit of an assessment post a personal visit will matter to decide on the next steps.
Okay, thank you, ma'am. Anybody else? Wants to add any points? Yes, sir.
Ma'am, first of all, medically we would like to thank them for fully care. socially the source of income or any supplementary income can be advised.
Okay.
And third, for the transportation of hospital for the further medical evaluation. Again, when required, the volunteer could be involved.
Okay. So thank you, sir. Definitely, we have to, yeah. So check their economic background. That's very good. Find out if they help with the change of catheter. So they need to, definitely they need to change the catheter. They need help because he is bedbound, paraplegic. He is not able to walk. His upper limbs are able to move, but lower limbs are not able to move. So he is totally bedbound. He needs catheter change. Also, the same time you have to think about the home care support. You can try to connect with the home care team, support team. So that way we can able to change the catheter. And also he has another problems. What about his family? So just you mentioned about definitely this patient need counseling and financial support. And also if you give a financial support, how long you will give? How long you can able to give financial help? You have to think about the vocational rehabilitation. Whether they can give some kind of occasional rehabilitation like candle making or poultry farm or that cot rearing or that kind of things from their patient's family part you have to think about. So you have to ask them with what kind of support you need to get an income, the small kind of income. So that way you have to help. So you have to find out whether there is any possibility for vocational rehabilitation. And also you have to think about the educational rehabilitation. Because of his problem, his children are not able to study. They stopped their studies because wife is a homemaker. Nobody is there to support the family. So they stop their studies because of this problem, he he will affect emotionally, socially, and spiritually. So from this patient mind, my children will get a good the study and good job and all. So because of his problem, they are not able to. So that will be affecting the patient emotionally and also emotional, the spiritually too. So you have to think about the educational rehabilitation. Here we covered physical part, social part, emotional part, and spiritual part also. Okay. And next this is the patient story. So we have lot of chat and received a lot of chat answer. So so Bangalore, our hospital has community development program. So with palliative care service, hope this will support both patient and family member. Okay. So neither. So yeah, as you all mentioned about, you have to do the proper assessment and understand the patient problems, and then definitely based on their problem, try to manage. So try to solve one by one. So then only we can able to provide a total care, and we can able to provide the quality of life of the patient. And the second, the patient patient story is 50-year-old man diagnosed with the cancer. His main complaints is pain. Patient is taking pain medications, not get adequate relief. So since last 1 month, he has taken different kinds of pain medications, but he is not getting adequate pain relief with that medications. He has wife and 3 daughters. one got married, the second daughter is not studying in the teacher training institute. Younger daughter is studying in 9th standard. So this is the patient story. Again, so I would like to hear from you all. This is the second patient story. If you have seen this kind of situation, this kind of family, so what are the problems you will find out?
Just a second. Sunanda, can you hear us properly?
Yes, yes, quite audible.
Okay, thank you.
Suppose he's
You're muted, sir. Sir, Wilson, sir, you are muted. Please unmute yourself and talk. Yeah.
okay. If he can move, he can be taken to a nearby palliative center where they will examine him and give morphine like tablets. And if he can also stay in the
He is on morphine, sir.
otherwise he can ask for.
Okay, he is on morphine right now, but he is not getting pain relief even if that morphine also.
That stage is very difficult because with so some sort of other medicine can be applied. And regarding the children, there is a scholarship in Kerala. If one of the parent is died, the school there will be stipend for students.
Okay.
If they are from TTC to standard 1, if their income is less than 1 lakh.
Okay. So definitely
so
we
in
can.
That way,
Yeah.
Yeah, that is the thing. I am associated with palliative care in Trichur, where we provide like that assistance. We will explore the government schemes and advise them and get the form filled up. Thank you.
Thank you, sir. Thank you. So definitely we need to explore the problems. He needs pain. Definitely, he needs pain management and pain management here. So we gave that weak opioids, like said that kind of a group of pain medications. We tried many medications, but so after that also the patients was not getting good pain relief. So why I am asking with you all is we have to find out the problems. So these patients come to the OP and said like I'm not able to getting pain relief with these medications. So after 3 or 4 days, we will, based on the patient assessment that things, we will increase the dose or we will change the drugs from one drug to another, next dose. So even then the patient will not get adequate pain relief because he has lot of other issues. We have to find out. So one of our volunteer went to his house and tried to explore their other problems. So we got lot of issues from the patient's side because that time the patient wife was saying he was not able to sleep. He was not able to eat properly because of this pain. He got good he is getting medications, good the pain medications, but he is not getting adequate pain relief. Why? What happened? We have to do the proper assessment. Here, the first the daughter is eldest daughter. The daughter is married, so that time he get a loan from the bank. So after 2 months, he got illness like this cancer. So he was not able to return that money to the bank. So that that notice, the bank has sent a notice. So this is there in his home. And the second daughter is studying in the second year TTC. She is not able to, because of his problem, she was not able to pay the amount, the next year fee. The principal told her to not, without payment, you can't continue the study. And the third daughter is studying in 9th standard. So then only we found these kind of psychosocial other problems there, no? So what we did was, we did many things for him, and we talked to the bank manager, we talked to the panchayat member, many things. We arrange a food kit to the patients, we arrange that education support to the patients. These all things we did for him. So after that, he got relief. Then he told us, so now I am free anytime. I know I will die. Anyway, I am free from my suffering. So after that, he got good pain relief, no? So next. So here also the 73-year-old female bedbound, having 5 children, all are married. Elder daughter is studying. Elder daughter is only one caregiver. Others are not supporting her. Her husband is a daily laborer. So how will we help these persons? So this is the common things in your community also. Nobody is there to treat these kind of persons, elderly persons. So we have to build. So this is the group on that first patient story. We give medications. We tried physical rehabilitation, wheelchair and airbed, because he was bedbound. So we need to prevent bed sore the formation. We provided airbed and wheelchair and food kit also. We gave education support to the patient, to his children, and occasional rehabilitation also. So this way we were supported. Because of the volunteer only, we connected with the patients. We were able to connect with the patient, because nobody is know this one person is lying there, no. So one of our community volunteer connect with us. And this is the second patient. You have to do, whenever you have seen these kind of patient, if you're a bedbound patient, you have to do the proper assessment. Not only the physical problems, you have to focus on the other aspects also. So if you do the proper assessment, then you can able to give a medication, proper medication for definitely this patient need a medication for his physical problems. At the same time, you have to find out the other problems and try to connect with the community, local community, and also you can think about the food kit and educational support and vocational rehabilitation. So this way we can able to support the second group patient, the second patient. And the third patient also, again, if you have seen these kind of persons in your community, definitely you have to find out the problem, try to involve the community, and psychosocial support is also need there, because nobody is there to listen or take care of the patients. Definitely, if there is any medication need there, you have to do some medication arrangements also. So coming to the physical care, as we discussed earlier, so these are the things we have to look into the physical part. Do the assessment and try to reduce their symptoms. If you do the proper assessment, definitely you have to try to reduce their that problems. And you can think about the provision of the physical aids, wheelchair, airbed, waterbed. These all things you have to think about. These all comes under physical care. And definitely you have to do the follow-up, because if you have seen one patient with a physical distress, sometimes the palliative care team will be providing some medications for that patient. Your duty to call the patient next day, and or you can go there and see whether that treatment is beneficial to the effective or good relief, the patient is getting good relief. That kind of things you have to do. Then only the patients may feel like, okay, somebody is begging them to help them. So these kind of things you can do. Coming to the emotional care, fear, and they will be anxious, and suicidal thoughts will be there because of this bedbound. So they will not be go back to their normal normal as previous, because this patient is bedbound, paraplegic. So life limiting problem is there. It's not able to back to as a normal person. So you have to think about that also. Because of this, if they understand well about this the problems, they will be thinking like, so that like suicidal thoughts will be there. Why I am living like this? Why? So these kind of gradually they will be going to depression. So if they have a problems there, definitely you have to address their problems, try to solve their problems. If their problem is not solved well, they will think about the suicidal things. So and sometimes guilt feeling will be there, loneliness will be there. So nobody is there. So just imagine a bedbound patient in the family. The primary caregiver wants to go out for making find out the money. Okay, so they need an income to live. So nobody is there in the home. So you just see this picture. The patient was asking, why me? Why I am living like this? So these kind of questions will be there all the times. So see the doctor emotion, the facial emotions. So the same time, I can also feel your emotions. That emotions expressed her face. So then only they will understand, okay, she or he is the person for understanding me well. So at least go and sit down and listen their problems. Nobody is there to listen their problems. That is the major that gap there. So within the community, if someone is suffering with a life limiting illness, if you get a time, go there and sit with the patient and listen their problems. If they are able to explore their problems, definitely they will get a good mental relief. And also you can think about the additional the problem solving. So because like other psychosocial issues, there definitely we need to address. And feeling of being a burden. So these all things, because of that family, other family members also affecting a lot because of his problem. So they need to take care of the bedbound patient too. So this will be affecting the patient and the caregivers. So because of me only, they will be suffering a lot. Why I am living like this? Give something to something, or kill me. So these kind of questions will be there. If they have a psychosocial issues there, or their emotions, if they are not able to explore, nobody is there to express their emotions, then they will think like this, and loss of meaning in life. So these all things you can able to address. And coming to the social care, no job, no money. So if they are not able to go work, so they don't get money, no. So if they don't have money, how do they live? And no food, loss of income. So because of his disease, the first two patient story, they are the earning member of the breadwinner of their families. Because of their illness, their income stopped. And because of their problem, they lost their home. They lost their land. They spend that money to their treatment. After that also, they will not go back to their normal position. So one day the doctor will tell them, so nothing more we can do. So they have to go to their home. So that time, their sometimes, so their land will, they will lost their land, lost their home also. So and also, if they don't have income, how do they educate the children? And unable to get the children's marriage. So these all will be affecting the patient emotionally too. If they have a social issues there, it will be reflected through the emotional factors. Coming to the spiritual care, so why did get this? Why did I get this disease? These kind of questions will be there. Sometimes the patients will be asking, why God punished me like this? Why I'm living like this? Why? So because of my sin, God punished me like this. So these kind of questions will be there. If you heard these kind of questions, please ask them why you are thinking like that. What happened? Is there any problem? So if you ask few questions about these kind of open questions, definitely they will start saying something. Nobody is there to take care of me. Nobody is willing to take care of me. So nobody is giving food to me. Nobody is there to give any attention. Nobody is so there in the community also. These kind of emotions will be there. So spirit, we have to address the spiritual issues also. Then now we understand the four components of palliative care: physical care, emotional care, social care, and spiritual care. Now we are thinking about how to organize a home care service. So we need a home care conveyances, and also we need a home care kits. So definitely, if we went to the home, if you find a problem, some physical problems there. So all the time we will try to manage in their home itself. If you are not able, if we are not able to control those symptoms in their home, then only we will think about the inpatient admission. So always try to relieve their problems in their home itself. And we need a trained volunteers. That is why we provided the volunteer training for the volunteers. So you should know what is palliative care, how to communicate with the patient who needs palliative care, and how to connect with the palliative care team. These all things you have to know. So after this, you are the person to connect with us. Okay, so we need a trained volunteers. We need a trained healthcare professionals too. So the MBBS doctor or the BSc nursing staff, they don't know what is palliative. They know what palliative care, one or two sentence, but in depth they don't know. So they have to, after MBBS or doctor or MBBS or BSc nurse, they should know what is palliative care, what are the importance of communication, how to do the pain assessment, how to provide home care that service to the needy persons, and how to manage symptoms in their home. That all things they have to understand. So that is why we provided training to the doctors and nurses. Okay, we provided online training to the nurses and offline training. Those who are able to come to us, they can come here and take the training, the palliative care training with us. And those who are not able to come here, they can do the palliative care training through online also. So definitely we need a trained healthcare professionals. And after that, if once you start palliative care in your settings, you need to do the team meeting. Each week you have to continue. You have to do the team meeting. You have to address the staff problems. You have to address the patient's issues. You have to come together and discuss the previous week problems. So is there anything more we can do for that patients? That all things you have to discuss with within the team. Then only your team will improve. So your care will improve, that quality of quality palliative care you can able to provide. So definitely you need a regular, you have to conduct a regular team meeting, and based that time you have to discuss the patient problems, and you have to think about the future plans also, and you have then you can think about the regular follow. So now types of home care, doctor-led home care will be there, nurse-led home care will be there, social worker-led home care will be there, on volunteer-led home care will be there. So sometimes definitely this is a teamwork. If a person need a doctor support, definitely the doctor will go there and see that patient. If the patient need only the nursing care, the nursing team will go there and see that, solve that nursing issues. Like for example, so on catheter change, that the nurse is enough, no? So the nurse need a conveyance, definitely. So we the nurses go there with the kids, that the home care kids, and go there and change the catheter and come back. So nurse led home and social worker led team. So here, so we were discussing about the psychosocial issues. Once the nurse identify whether the patient is having a psychosocial issues, then our duty to connect with the social officers too. So they are the person to explore more. Okay, if you have a social worker or a psychologist there, you have to connect with them, and then they can also involved in the patient care and try to explore more problems, and that way we can able to reduce their problems. And then volunteer led home care again. So volunteer is the most important person in palliative care, because you are the person to find out the patients in your community and connect with this. So volunteer led home care is also important. You have to come there, you have to go there, go to the patient's that house, and see the patient sufferings, and again now you understand about how to talk to the patient. Don't give any false hope to the patient, don't give any premature reassurance to the patient and family. So these all things you have to keep it in mind. And emotional, your facial expression, so non-verbal expression is also, you have to keep it in mind all the times. From your face, they will understand something. So you have to go there, and all the communication skills you have to practice, and don't give any false hope, and try to understand their problems. And if possible, you can give some, if you know well, then you can teach some health education. So I'll come to that part, what all things you have, you people that done for able to done for the community. So that all things I'll tell you. So definitely, if you find these kind of patients, you are the persons to find out the problems and try to connect with a good palliative care team. And emotional support. So this is one of the important part the volunteers can do without any support, so you can communicate with the patients or anytime. If you have any time, definitely go directly to the patient and communicate with the patients, and listen their problems and exploration of problems. So these two things you can able to do it whenever possible. So coming to the general hygiene of a bed-bound patients, if you have seen a bed-bound patient in your community, so what all things you can do as a volunteer? So you have to make sure that whether the patient is able to take a daily bath. If the patient is not able to take a daily bath for a bed-bound patients, whether the patient is getting sponge bath, that is bed bath. Okay, so that you have to explore it. And proper, whether the patient is getting proper skin care, oral hygiene. So these all things we can look into. Okay, so again, for the skin care, bed sore prevention. So for a bed-bound patient, the patients will be, this is one of the major problem with the bed-bound patient. If you are not turning the patient position, they will be getting pressure sore. So these things you can educate the patient family without the medical person. Because if you have seen a bed-bound patient in your community, what you can do is you can tell them, if you don't change, if you not change the position every 2 to 3 hours early, definitely the patient's skin will break down. So these all things you can tell the patient and the caregivers. Then only they will. Sometimes they don't know this kind of the pressure sore will come or not. So if you have seen these kind of patient, definitely you can educate the patient about the general hygiene, skin care. You can think about the comfort device, air bed or water bed, and also you can do the follow. Okay, so usually for a bed-bound patient, we will provide a air bed or a water bed to the patients, because if you suggest these kind of bed to the patient family, definitely they will accept. But at the same time, they will be thinking like, if you keep the patient on this air mattress or water mattress, this mattress will take care of everything. So that is the wrong message. Even if the patient is in air bed or water bed, this is the small that bed is a supporting device, not 100% preventing pressure sore device. So only supporting device. They have to change the position, but the duration you can increase. Instead of 3 hours, they can change the position 4 hours. So that time, that the air mattress or water mattress will look into. So otherwise, the patient will get pressure. Coming to the oral hygiene. So 90% of systemic diseases are linked with oral health. So if you are not giving proper oral hygiene, if they are not maintaining proper oral hygiene, definitely they will get other systemic diseases also. Even if the patient is in bed-bound also, you have to tell them to provide a good oral hygiene. So if they are able to, like a paraplegic patient, then you can able to help them. They can able to sit. You can help the patient and arrange all the articles nearby to the patient and ask them to rest. Okay. So only the help is needed. The caregiver will help to the patient arrange all the articles nearby. So and self-care is also self-care education is also important. As we all know, brush the teeth twice daily, and also if the toothpaste left in the mouth can cause dryness. If someone's that complaining of dry mouth, definitely you have to think about whether that any toothpaste left in the mouth. These all things you have to think. Rinse the mouth with warm saline or soda bicarb solution. So tongue also they have to clean with a soft brush. Ask the patient to take plenty of fluids if they are able to. Then if they are using dentures, they should be removed at night. So these all comes under self-care educations. If they are not able to do the oral hygiene alone, like a bed-bound patient, an unconscious or a semi-conscious patient, how will you do the oral hygiene? How will you that give a oral care to the patient? Then you have to think about the homemade. In the hospital, we have normal saline, we have artery forces, everything in the hospital. You have to think about the home. No artery forces, no the truncative forces, nothing. Normal saline, nothing. So you have to think about the patient's home itself. From the patient's home itself, you have to prepare the homemade saline or soda bicarb solution. You can take 500 ml of water and add 1 teaspoon of common salt. Boil it cool and keep it covered. So that solutions you can use for mouth care. And the next option is soda bicarb solution. 500 ml of water, add 1/4 teaspoon of baking soda. So again, the same thing, boil it, cool it. So that water you can use for mouth care. So how we can do mouth care for an unconscious patient is, you have to take 2 spoons. The handle of the spoon you can cover it with a cotton piece, cotton rod or a gauze rod. Okay, so 1 spoon we need for opening the mouth. If you put your finger into their mouth, what happened? They will bite. They don't know. The semi-conscious patient or an unconscious patient, they don't know whether your hand is going to inside or not. So they, if anything goes to their mouth, they will start bite. So what you can do is, you have to tell the caregivers, take 2 spoons, and once to the first spoon, the handle of the spoon, they have to wrap with a gauze piece or a cotton rod, and that will be therefore opening their mouth. Then you can take another spoon, and same way you have to wrap it, and then you can that spoon you can put it in the homemade saline and choose well out of the excess water. Then you have to clean the one side first. If you keep the forceps in the left side, the right side mouth will be open. So that time you can able to clean the right side. So then the same way you can keep that spoon, wrapped spoon in the right side, then you can able to clean the left side of the patient. So this way we can able to clean the oral cavity. So next is catheter care. I hope most of you you have seen catheterized patients. So this is a catheter, Foley's catheter. We were discussed one patient about the Foley's catheter, that drainage. So this patient need a catheter change every month, because one important part we should understand is, we should not, we are not an authorized person to put that catheter. Okay, Foley's catheter. So one of the trained persons should put that Foley's catheter. So because this is they have to maintain aseptic techniques. If you don't maintaining a aseptic technique, they will get an urinary tract infection. Okay, so here what all things you can do is, as a volunteer, if a patient is having Foley's catheter, this catheter is inside the bladder all the time. So this is a foreign body in their body. So because of this catheter inside the bladder, these patients will be developing, the chance to developing urinary tract infection. So our first duty to educate the patient and family about the oral fluids intake. They have to take a proper fluid intake. If they are taking good fluid intake, definitely they will not get urinary tract infection. So this is the one important part you have to tell the patient, caregivers and patient. And also they have to clean the perineal area well with soap and water. That is the second important point. And the third one is bowel care. Their bowel will be moved every day, because if they have a constipation there, definitely urinary tract infection will be there. So their bowel will be moved every day. They have to move pass the stool every day or every alternate days. Otherwise, if there is a fecal infection there, the patients will get with the urinary tract infection. So these all things you can educate with the patient and family. And the third important point is ensuring compliance. So drug compliance is the major part. If when you see these kind of patient, bedbound patient in their family, you have to take their medications. You have to ask them what are the medications you are taking. So show me that they are definitely they will take it out. So you have to check whether there is any proper instruction is there, and you have to ask them. So if there is a instruction there, you have to take the tablets out from the that pocket, and then you can just ask them, how do you take these medications? Whether they are taking these medications correctly. So sometimes they will be complaining about their the physical problems. Then your duty to find out whether the patient is taking the medications properly as by the doctor's prescription, and check the number of medications each visit, whether they are properly taking. So if sometimes they will be telling, yes, I am taking properly, then you have to check the number. And so considering the financial status also, if they are not affordable, you have to get that medications from the palliative care centers or any other that way. So definitely you have to think about the financial status, and also if you suggest these instructions, if you give a instruction to the patient, along with that you have to think about the clock. So whether they have a clock for that checking time. So that is also important. So now I would like to hear from you all. If we provide palliative care, or if you provide home care to the patient and family this way, like home-based care to the patient and family. So what are the benefits there? What are the benefits they will get? Do you think the patients will get benefit?
Certainly, there will be a big burden off their shoulders. First of all, whatever physical discomfort is there, that we are trying to alleviate or ameliorate. Along with that, other issues also, going to the hospital, coming back, that takes a lot of time, energy. So if there is somebody to attend to these issues at home, it is definitely more comfortable for the patient.
Yes, ma'am. You are correct. You are correct, ma'am. Thank you. Any other points?
Hello, may I come in?
Yes, sir.
So, at times, these old patients have a dementia. Many times they forget to take the medicines, and many times they take the medicine double dosage.
Okay. So how do you manage? How do
We
you?
have that one box comes with 28 brackets into it, and we have to separately keep the medicines.
Okay.
And from there, they will come to know whether they have taken the medicine today or not, or the proper dose is taken or not.
Okay.
They come for a week, weekly dose, 15 days, 28 days, accordingly. The depth of the bracket will be depending on the number of tablets.
Oh, okay.
Those ready boxes are available. Okay.
Okay.
So when we go once in a 15 days or once in a 7 days, we have to segregate the medicines and keep it accordingly, so they never miss any dose as well as any medicine.
Okay. So dosage box.
Huh?
I don't know about that. So anybody else?
Yeah, those boxes are, hello. Those boxes are available in all the novelty stores and the utility stores, and they will have it's available very freely.
Okay.
Yeah.
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 Any other points? We are talking about the benefits. So Abhilash sir said we will be to improve the dignity and the quality of life of the patient. We will also be great support to the caregivers and their families. They don't have to lose hope. Definitely, if someone is there, definitely they will think about, okay, somebody is there to help them. So definitely they will feel support. Any other points? So let's see one by one. So as you mentioned earlier, patient and family feel support. So just see that image, the patient, the caregiver face. Even if the patient is on fluid, not able to take anything orally. So initially, he was able to come to the hospital and take treatment from the hospital, but now he was not able to come to the hospital. Because of that, we provided home care support to this patient. So see her face, how pleasant. Even this kind of distress is there, but when the palliative care team goes there, how much that the feeling. She told me like after getting this, her husband got this kind of cancer. So after that, nobody is there to nobody's no relatives, neighbors, nobody is willing to visit this family, because of maybe she told me like sometimes if we ask financial support to them, so that is why they are not willing to come to us. So that kind of resist that will that not that come to that point, no. So they that kind of the relationship break will be there. So that time you are the persons to go there and see these patients family and see their emotions, listen their problems, and try to solve their problems. So definitely the patient and family feel more support. Patient relief receive individual attention. See, if you provide a home care, so just think about a patient, the outpatient setting. If you go to the hospital, if you are going to go to the hospital and see a doctor, how many patients will be waiting for seeing the doctor? So the doctor will be distributing his time to everyone. So they will spend 5 minutes. They will sometimes they will spend 3 minutes. If they have less problem, only 1 minute, 2 minutes. That kind of things. So that the same time that person has lot of emotional problems too. So they will be focusing because of the busy OP. They will be focusing on the physical part only. So here, if you provide a home care support to the patients, you can able to give a individual attention. And here the patients get less social isolation. Nobody is there, no? They are free. Their home. They are comfortable to talk anything. Nobody is there so no worry about others. So if they ask within the hospital, they will be afraid about the other persons. So if I say something, they will be hearing my problems. So they will hide the truth always. Here, less social isolation, patient remains a part of the family also. If the patient is in the home, so they will feel like that. And also, you can able to do the full assessment of patient and family. So when we sometimes when they come to the registration, so they will usually if a person's come to the hospital, they will wear good dress there, and they will come with that good moon, no. So that time we will be thinking like, okay, they will be financially good enough. So because of their external that maybe the features and all those things, when we go to their home, then we can understand about their that total picture. So sometimes nobody is there, no financial support is there, no rice, sometimes no rice, no vegetables, no nothing will be there in their home. So even even then they will come with a good dress. So because of you have, when if you do the home care, definitely we can get a full assessment of the patient and the family. We can able to understand in the family dynamics also. If they have a problems in the problems within the family, so some problems there, definitely we can able to identify. And also you have to think about the patient, the problems, like any anticipated difficulties, any like bleeding, head and neck cancers will be is there, that time bleeding will be there, no? So if there that kind of situations you found, you have to prepare the patient family, like breathing difficulty. If they are in the rural area, they are not able to come to the hospital easily. So if you develop these kind of physical problems, you if you think like that, definitely the palliative care team will prepare the patient family how to overcome that situation. And definitely we need a total care, we need a teamwork. I think you all thinking like, okay, how we can do palliative care, how will we do? So because we need a good teamwork. So definitely we if you do together everyone achieves more. So team is also together everyone achieves more. So team includes volunteers, social workers, nurses, doctors, physiotherapists. All team members need training. So definitely the medical persons and non-medical persons who are willing to work in palliative care, definitely they need a proper training. They have to understand about the patient suffering, and they have to understand about the total care. They have to understand the each member is important. Teamwork is also important. So we all the problems, we have seen many problems, we are not able to cure the problems 100%. We will try to cure the problems, sometimes we can't. So and also the problems, the symptoms, we will try to manage the symptoms satisfactorily. So we will try to manage their symptoms as much as we can. But we can do one thing, we can comfort, we can able to provide comfort all the time without any support, without any help. You can able to give support or comfort to the patient and family as much as you can. So it is how much we give, but how much love we put into giving. Whenever you have seen a patient in their home, what you can think do is, you have to, if you are able to spend 5 minutes or 10 minutes to the patient family, just give a full attention to the patient family, and give a good try to give good care, and try to explore their emotions, and you that way definitely you can get a good satisfaction. If you do like this, definitely you will get good mental satisfaction after the patient's care. Thank you. Any doubts?
Thank you, Sister Sheeba, for that detailed presentation, and I'm happy that everybody's interacting as always. Yeah, any questions, anyone?
Yes, I would have one. Thank you. I think first and foremost, yeah, like Sunanda ji just said, it's been an excellent session. Yeah, I think with each day it's getting more insightful, giving us clarity in terms of, when we want to take this work forward. But along with that, I really want to ask Sister Sheeba in her experience, because I think Pallium India is doing this work day in and day out, right? My only two concerns which keep popping up in my head when this kind of work is really started, right? Because the needs will be never ending. There are so many patients. How to really make it self-sustaining is my only concern, right? Because when you'll say volunteering, and anybody who gets associated, I'm sure it's more also professionally that they'll be need to be, taken care. And when I'm saying self-sustaining means when we go, it is not only like we said, right, the sociological or the psychological needs or the physical needs that we'll be taking care of. But when we are saying the economic needs, that's my biggest concern, because a big chunk of these patients are the way they are because that part of it is not being met within the families, right? All the case studies which sister just discussed today, see, there were children, no financial support because even they were still getting educated, right? So that does add to the pressure and affects the overall mental well-being of the patients. And if the caregivers can't live up to that, again, it's pressure. So yeah, I mean, that's also making me think now of some innovative way maybe. Because yeah, it will be very bad if you start something and then you're not really able to take care of one part of whatever is, a major chunk of that palliative care. But an excellent session.
Okay, thank you.
Absolutely delighted. Yeah, thank you, sister.
Thank you. So, okay. So, one question. Airbud. Umesh sir is asking about airbud. What do you want to know about airbud? Which one is better, airbud or waterbed? Okay. So the airbud is the good one because that airbud need that electricity. Waterbed does not need an electricity. But the thing is, airbud has two rows. The alternate changes. The one row, the alternate rows will be inflating and deflating. The automatically the pressure relieving is happening there. But at the same time, in between the rows, there is a continuous pressure in between the rows. Okay, continuous pressure. So if you are not changing the patient every 3 hours early, so that area, the patients, the bedbound patients can get pressure ulcer. So that is why we suggest, even if the patient is in airbed or waterbed, we have to change at least the frequency, the durations you can increase, but frequency, like usually we will tell 2 to 3 hours, at least 4 hours is enough. Every 4 hours you could change. So okay, Ajay sir is mentioning, I also working with an NGO. There one patient who avoiding the airbed. What we do, give him comfort. So airbed. So if they are not willing to put an airbed, you can think about the soft mattress. So soft mattress, at least soft mattress is enough. But at the same time, you have to think about the pressure sore prevention, the techniques. So they have to change the position. They have to inspect their skin all the times. Whenever they turn the patient, they have to inspect the skin. And also they have to give some massage using simple moisturizing cream, or they can use coconut oil. Give a good massage. That way we can able to improve the blood circulation. And if the patient that skin blood circulation is good, then the patient won't get any pressure ulcer. And also you have to think about the protein intake. So if the patient is not taking the food properly, the patients will get pressure ulcer. They should take proper protein intake daily basis. Otherwise, the patients will get pressure ulcer. And moisture. So if there is an incontinence of urine, continuous, the moisture is there, wet there, definitely the patients will get pressure ulcer. So continuous pressure, moisture, friction. These are the most common, the major 3 causes of pressure ulcers. So friction. So for a bedbound patients, we need to change the bed sheets. we used to pull the sheets under the patients. So that time the patients, because of the friction time, the skin will break down. So what you can do is you have to turn the patient first and roll the sheets and pull towards the patients, push toward the patients and spread a new sheets, and then turn the patient again, and then you can remove the old sheet and spread the new sheets. So that way we can able to spread, give a new sheets. You can able to put a new sheets instead of pulling the sheets under the patient. So these all way we can able to prevent pressure ulcer formation. So, and another question, any advice for caregiver looking after paraplegic husband for over 5 years? So what do you think? So last 5 years, she is there for take care of her husband. So what do you think?
She should also take some, I don't know, break is the right term, but yeah, some time for herself and get away from that. Otherwise, it'll affect her health. And in turn, in the longer run, that will affect how she is able to take care of the husband also. So maybe some time off from that regular responsibility in whichever way is really crucial.
Yeah. Thank you, ma'am. So you have to talk to the children first, and you have to arrange find out the problems. If only the caretaker role is there, one children will come there and see at least 1 or 2 days. That time his wife goes there and stay the other the children's family. That kind of, so you have to think about the respite care also. So always, as I mentioned earlier, from the point of diagnosis, the patient caregiver is also suffering. So, but nobody is there to listen their suffering, their emotions. So here we have to give a special attention to the family members, the primary caregiver too. So here, what you can do is you can think about the respite care also. Respite care is you can bring the patient to the hospital without the family. Only patients the patients can come to the hospital. The nurses will take care of the patient well. So that time the caregiver will get free. They will get a free time. So maybe 1 or 2 weeks they will go anywhere, and maybe they can go to their children's. So most of the time, because of the bed-bound patient, they will not be able to go anywhere. So these kind of, if you do these kind of things, they will get free. So caregiver, yeah, again one more question. Caregivers are paid 750 per month for economically weaker sessions. So here, usually the caregivers, if you find a paid caregivers, usually you have to pay 750 rupees per day. So always try to manage. What we hear is, we bring the patients, if there is no caregiver there, try to arrange a paid caregiver. If not possible, our nurses will take care of that patient. So that way we manage here. In the family, what you can do is you have to involve the community, involve the local community volunteers can help to the patients' caregivers, because maybe alternate days go there and at least help them to bathing the patient or changing the sheets, go there and listen their emotions. That kind of, you just try to involve the community volunteers in this kind of situation. If they are not affordable, then the next option is to include the community volunteers. Ma'am, you are, yes.
Yeah, I just asked, yeah, one question even in the chat box. I just wanted to know how do we allocate duties to the volunteers? I mean, especially with your kind of experience, and who decides at what frequency that particular patient would need what kind of visits? And of course, are the volunteers paid or they are volunteers?
Shiva, we are not able to hear if anybody is speaking.
Yeah, okay. Sorry. So here, what you can do is, we usually from the maybe each place we will get each one person will be from Kerala, in Trivandrum, many places, no? So they will take care of that particular community, and also they
There's the echo, Shiva.
yeah. So they will find the patients, find out their community, and they will connect with this, no? So then they are the person to do the follow. So the allocation is not, we were not allocating any patient to the patients. If the patient is coming from like Pune, if we have a telemedicine facility, if we get a patient from your that place, definitely we will try to connect with Sunanda ma'am. Sunanda will arrange a local community volunteers, that community nearest volunteers. If there is any community volunteer near the patient's house, definitely Sunanda ma'am will be connecting you with that patient's with that family. You are the
Sister
person.
Shiva,
Hmm.
I think can we just explain them about how our link center works so that at least they know how the volunteerism works
Yeah.
in Kerala, and then we can come to the
Yeah. So here, so initially what we did was we did a awareness program to the community. Okay, so if just we went to the community, we first we will convince to the panchayat member and ASHA workers and all. So after that, they will be informing to the community people, and they will arrange an on-hour awareness program on palliative care to the local community persons. If you do the but nobody's no what is palliative care. So for that, we will give 1 hour awareness program to the local volunteers, local community persons. They are not an volunteer. So they will, after the 1 hour awareness program, few persons will got interested. Okay, so I am willing to provide that spend my little time to this kind of persons. Then that persons we will give a 3-day volunteer training program like this. Okay, sometimes 30-40 persons will be attending the awareness program. So out of 50, you will get only 10 persons. So for 10 persons, you can give a volunteer training program. So after the volunteer training program, they will be working into their community. So if they find a patient into their community, they just go and see, assess the patient and find out the problem and connect with us. Then they are the person to do the follow-up also. They will be working for their community. Clear?
Yeah, Sister Shiva, can I add something?
Yes.
Yeah. So actually, in this group, I think most of us are from the city. So that's why we'll need to understand how in the city will work. So I'll give you very recent development or thing. So what happened recently? We got a call from one of the private hospitals in Pune because they wanted to understand and go for awareness session for their team of doctors and nurses on palliative care. So as a person who based here and I'm working in this field, so I contacted one of the doctor who is trained in palliative care, and then we went and had a session. So now what will happen? There also we have told them that if you have friends and families who are interested to know, even if they're not doctors, nurses, or anybody, but they can come for the volunteers training. And I told them that one batch is already going on, and if you want, we can also plan for another batch. So at least if I say that maybe in a month or so, if we get some requests, we'll be having a volunteers who are from a particular city. And then after the training is over, maybe we can have at least 10 volunteers who will come to us saying that we can give our time or something. So that's how the thing builds up. Also, again, I want to tell about the Maharashtra team. Tina is here and Parulji is here. So that's how we came together. We got together and we decided that Maharashtra should have a team of volunteers who are ready to give their time, resources. So that's how it will slowly come up. And then regarding the charges, I think in volunteership, we don't entertain any kind of a payment. So it has to be free of cost, and people are there who really want to give their time or contacts or in whatever way possible for them. So that's how we can start the work. Let's see, after the batch is over, we'll get back to all of you that what all you can contribute. See, there are examples like we have now 50 people out here. So one can give their time, one can say I have got contacts, so we can reach to doctors or nurses. So it depends on your strengths and where are you from, what's your background. So that's how we can work it out. Nothing to worry. So we have still one more day to go. So let's plan. Thank you.
Yeah.
So we have a community part that palliative care session tomorrow. So that time we will discuss more about that. And one more question, Ajay Kumar sir has mentioned about one patient's problem. So for that things, I think we need to find out the cause of vomit, identify the cause, because when the patient, if a patient while turning, the patients will get vomited. That's why I understand from this that chat. So what you can do is you have to identify the cause of vomit. Why the patient is vomiting, you have to identify, and maybe because of overfeeding will be there. So after that, you can manage. Definitely. Sunanda ma'am will give my number. If you need help, please call me. So
I think
ma'am,
Senior or Anup, you can just put Sister Shiva's number in the chat box so that everybody can.
okay. So I think if you need any help, please call me, sir. No worry, I will help you.
I'll share the contact details in the WhatsApp. I think.
Yeah.
Okay.
And also, I think on the last day, we'll be sharing them the helpline number, right, Senior?
Yes.
Telemedia's helpline number, yeah.
Yes.
Yeah, you can connect with the telemedicine number also. Then they will help. One doctor and nurse will be there. They will give a WhatsApp video call and see the patient problem and try to solve it. Thank you.
Yes.
Oh, that's
Thank you,
nice.
Sister Shiva. I think we are now crossed the time, but that's good. We had a lot of discussion. So thank you very much, Sister Shiva. And it's so good to see you and your presentation. And thank you very much, all of you, all the participants. And see you all tomorrow. Have a very good evening. Take care of yourself. Bye-bye. Over to
Thank
you.
you. Thank
Anup.
you.
Thank you.
Thank
Bye-bye.
you. Thank you all.